Yeah. So, really, every woman that goes through our process starts with learning how to track and chart their cycles. Now, for most women, it's very obvious, when you're bleeding, when the menstrual cycle starts. Many of us track those days of bleeding. But the added piece that we're looking at is looking for signs of ovulation. And in our world, we call ovulation a vital sign. So, just the same as you go to the doctor's
Okay.
office, we check your heart rate, we check your blood pressure. In my world, we're checking your ovulation. Because even if you're not trying to get pregnant, ovulation is a really important sign that if ovulation is happening consistently and it's timed appropriately within your cycle, we know that there's lots of other health things that are aligning and that are going well. On the flip side, if you're not ovulating regularly, that can tell us, hey, there's something underlying that's not
Yeah.
going well, whether it's specifically with your hormonal health or just your overall health. And so we look at that. And so some of the ways that we do that is through tracking with what we call fertility awareness methods. And so we actually
Okay.
have about 10 different instructors that teach throughout our clinic, and they teach different methods of fertility awareness. And
Oh,
primarily, what they're doing is they're helping you to identify different signs that your body is telling you on a daily basis as to what's going on. So, for example, we teach you how to track things like your cervical mucus or your cervical discharge. And this is not an internal exam. This is a very easy, straightforward thing. Most women
yeah.
have some awareness that they have some sort of discharge that's happening, and it doesn't mean it's a bad thing. In fact, it
Yeah.
oftentimes means it's a good thing. Some of the other things that people are aware of can be through tracking things like urinary LH metabolite strips, right? So, like
Okay.
the LH strips that you check to see, do you have a positive ovulation? And then the other third one that women commonly will be tracking is their basal body temperature. And so when we align some of these different pieces, and for some women, they track just one sign, some like to track all three or more. And when we look at these things all together, that helps you to identify not only what is the day that I ovulated, but also when is the window that I'm fertile. And I think that's another common misconception is that I think women believe that I can get pregnant all the time. And the reality is that for most women, there's a period of time, usually about 5 to 7 days, that are
Yeah.
fertile that you can get pregnant. And so if you are trying to avoid pregnancy, then you avoid intercourse for those days. We always joke
Thanks.
you can do other creative things. That's okay. But during those times, if you're trying to avoid pregnancy, don't have intercourse during those times. Otherwise, beyond that, you can have intercourse on the other days that are not fertile and you won't get pregnant. And really, when we compare these methods as far as how effective they are, they actually, many of them will reach efficacy of 99.8 to 99.9%
Wow.
effectiveness, which is actually better than hormonal birth
Yeah.
control pills. And we're also then avoiding all of the unnecessary side effects and downstream things that can happen with birth control, whether it's blood clots or nutrient deficiencies. And so really just empowering women to have this
Yeah.
awareness of what's going on with my cycle. How
Yeah.
can I manage this in a different way? And that would be just from the standpoint of, how do we avoid birth control? We use it for lots of other things as well, but that's kind of how it works as far as learning how to track your cycles in order to stay off birth control for contraceptive reasons.